Hi, good morning. Myself, Dr. Giridesh. I am consultant nephrologist from Coimbatore. So I am here to speak about pedal edema. So what is pedal edema? What are the causes of pedal edema? And how to diagnose the causes and how to treat it. Okay. So pedal edema is nothing but the swelling of both lower limbs. Okay? It could be either in one lower limb or it could be in both lower limbs. So based on the causes, there are main number of causes for swelling of the lower limbs. Okay. So firstly, we can classify it into a local cause, like any problem in the joints or any problem in the legs due to some trauma or infection can cause pedal edema. But in such cases, the pedal edema is usually unilateral. That means only either of the limb will be affected. Okay. And there are more causes like systemic causes, which we say that it's because of some organ failures or organ issues. Swelling would be in both lower limbs. Like, for example, the first cause would be like heart failure. Whenever the heart pumping, left side of the heart is for pumping, if there is any reduction in the heart pumping, there can be excess of fluid which can build up in the lower limbs. Even right side heart failure can also cause pedal edema. And next is like liver failure, when the liver cells get shrunken because of like more causes. There will be like liver failure, and which will also cause fluid accumulation. It can be in abdomen or both lower limbs. And next is like kidney failure. When the kidney's function gets deteriorated because of the inadequate urine production, there will be more fluid retention in our body, which will cause pedal edema. And another most important renal causes, our kidneys are meant for filtering, like filtering the blood. So the good product needs to be retained inside the body. Only the waste products are to be excreted in the urine. In such cases, there are few conditions where the albumin protein, which is to be filtered, which is not to be filtered via the kidneys, get filtered and it is excreted in urine. So when more amount of albumin gets excreted, the amount of albumin in our body gets reduced and we may have swelling of the limbs. So this is called nephrotic syndrome. And there are very rare causes like when there is low protein in our body due to malabsorption or because of increased wastage via gut. Like whatever we are having food that has to be digested and albumin has to be absorbed. In any problem with the intestines, there can be malabsorption. Like the whatever we are taking might not get absorbed. So the amount of albumin in the body will get low and we may have swelling of the limbs. And there are few drugs which also can cause swelling of the limbs, especially the medicines which we take for BP may cause swelling of the limbs. Okay? So these are all the overall causes for swelling of the limbs. Next, coming to how to diagnose. It's basically the diagnosis is clinical. Whenever we see a patient clinically, we can say that patient is having pedal edema or not. The causes whichever we have discussed now are all pitting pedal edema. That means whenever we apply a pressure over the bony prominence of the legs, we may have a pit. I mean, we may have a dimple because the fluid gets replaced. So this is usually the pitting pedal edema. There are few causes where we may not get pitting pedal edema, but there will be swelling of limbs. Okay, those are called non-pitting pedal edema. And especially when we have hypothyroidism, when the thyroid function is low, we may have non-pitting pedal edema. And there are a few causes like lymphedema. We usually hear the word like elephantiasis, like when there is lymphatic obstruction. There are some blood vessels in the legs in our whole body called lymph, which when they are blocked or when there is stasis of the lymph, we may have non-pitting pedal edema. Okay. So identifying the cause is more important. Okay. So the identifying the causes, we have to do some blood tests and urine tests, and we may require some imaging also. Starting the blood tests, the basic blood tests like hemoglobin. When there is low hemoglobin, there is more stress to the heart, so that will also cause pedal edema. And then we have to check our liver function test. We have to check our albumin, what is the body albumin. Then most importantly, kidney function tests like urea, creatinine, and more importantly, urine protein, which will quantify how much albumin we are leaking. I mean, whether the urines are having albumin or not. If there is an albumin in the urine, then we have to quantify it. There are many more tests to quantify how much protein we are leaking, and based on that, we can have a diagnosis. And coming to the imaging, the foremost important is an ultrasound of the abdomen, which will look after both the kidneys and the liver, and we can have an idea about how the function is. Next is echocardiogram, ECG and echocardiogram to assess the cardiac functions. So these are the most important blood tests and imaging tests based on which we can identify what are the causes of swelling of the lips. Next, coming to the treatment. The most important is this PL edema is mainly because of the excess fluid retention in our body. So the most important thing we have to do is we have to restrict our fluids. The amount of fluids which you have to take depends on patients and based on their volume status. So it's always better to consult your doctor and get how much fluid you have to take. Okay. And next important thing is salt restriction. The more the salt we take, there is overbuild of sodium in our body, which will cause and retention of fluid. So always, whenever we are having excess fluid in our body, we have to try to restrict our sodium intake. That's what we usually recommend is 4 grams of salt per day, which approximately equals to 3/4 of a teaspoon of salt per day. So we have to add only this salt in food which doesn't have salt. So this should be an total amount of salt which we have to take per day. Next is coming to the drugs. There are many drugs which reduces the swelling of the limbs by increasing the urine output. Foremost important among this is loop diuretics, which we call as loop diuretics. Diuretics are the drugs which increases the urine output, and among them, loop diuretics are more important for reducing the swelling of the limbs. Among them, there are many drugs like furosemide, torsemide, and all. Among diet and furosemide are the most commonly used drugs to reduce the swelling of the limbs. The dosage depends on the patient. Usually, we start with a lower dose and we increase based on the patient's requirement. Okay, and we should keep in mind that always the dose need not be fixed and it varies from time to time. For example, when patient comes to us with increased swelling, we have to prescribe a higher amount of dose. As the swelling reduces, the dose needs to be de-escalated, or else the patient may have lose more water in the urine and may get dehydrated, and that also would cause problems. So it's always wise to use judicial amount of diuretics when patient is having swelling of the lips. Okay. And we have to, as I already mentioned, we have to identify the cause of the swelling of limbs, whether the patient is having cardiac failure or renal failure or a liver failure, or because of any other drugs. We have to identify that cause and we have to treat it specifically to get completely rid of the swelling of the lips. Yeah, thank you.